world just needs this helping hand.
The birth of a child is a joyous occasion. The entire family celebrate and welcome into the world a beautiful, healthy baby. Or so it may seem. In Jamaica, the situation is critical. Approximately 40 to 50 newborns are diagnosed annually with congenital heart disease. Sometimes the symptoms go unnoticed for years, but in other instances, the problem rears its ugly head right at birth.
What we find sometimes, actually fairly frequently, is that it's really a matter of luck because whether some children get operated on or not. And we happen to be here at a time when there's a young child who's, I think, almost 3 months old, that's been in the hospital all that time, either on a ventilator or at least some kind of respiratory support because the child has bad heart failure from their particular congenital heart problem. Excessive blood flow to the lung keeps them in heart failure, and it's a problem that medications alone just haven't been able to handle. So the child has spent really all his entire life in the hospital except for the first 4 days. Well, we happen to be here so we can go ahead and operate on this child. Unfortunately, if we're not here, sometimes these children just can't be taken care of. And once we close the hole on this child and prevent all this excessive blood flow to the lung, then the child has a chance of getting better, and is in fact getting better already.
The Jamaica Children's Heart Fund was established to address the rising number of cases involving children with life-threatening congenital heart defects. The volunteer team of doctors, nurses, and specialists, headed by Dr. Richard Perriman, coordinate and use their personal time to make the 4 trips that are scheduled annually. The families affected are poor and cannot afford the costly life-saving surgeries. This program gives the most needy a chance at life. It provides hope to an otherwise hopeless situation.
To tell you the truth, man, we feel good about how they deal with us. They don't make we feel sad or left out. And for the money part, I'm so grateful. We don't really have to pay the big money that we were going to pay.
It takes great strength and courage to endure major surgery on both the parents and the patient's part.
I'm going to take care of you.
But it's much easier knowing that there's a qualified and experienced intensive care team working together with the local hospital's medical staff to ensure the best possible outcome for their tiny patients.
I'm fretting, I'm telling you the truth, I'm fretting. But as I say, this team is very, very, very good. So I just leave everything to them and to the Lord. And I know they will fix it and the Lord will fix it. So any parents out there who have a doubt, just come, just save a child's life and everything will be okay.
Jamaica Children's Heart Fund came and offered to assist us with the surgery by providing not only a team, a medical team, but also the necessary equipment and medical supplies and drugs to do cases in batches, that's just fantastic.
The Jamaica Children's Heart Fund is passionate about saving the future of Jamaica by saving one tiny heart at a time. Have a heart and heal one.